We are doing really a randomized study on colorectal cancer screening on a population level. So a lot of municipalities participate, not the whole Finnish population, but the coverage is about 45% now. And we screen only half of the patients, and the other half serves as a control group. Well, that test is used for diagnostic purposes also. And this test is, well, it's easy, it's cheap. The test can be done at home. The screenees can do the test at home and send the test cards to be analyzed. So in that way, it's practical. Well, people have to accept the test. They have to participate. So of course, there might be some aversion when doing that at home. But anyway, you have to take the stool samples. And in Finland, we've noticed that the acceptance is quite good because 2 out of 3 participate. We test people aged from 60 to 69 years old, and they have the test every 2 years, male and female. And so everybody who's willing to participate takes 5 rounds. And this is the other half, and the other half serves as a control, so they do nothing, they are not contacted in any way. People accepted it quite nicely. They were ready to participate, and the program has also shown that the whole screening chain is feasible. It's practical. It can be done because if the person tests positive, he or she has to be referred to further examination, which usually means full colonoscopy. So this whole chain includes also usual primary health care level. So they have to have the access to do the colonoscopies or refer patients to colonoscopies to hospitals. The purpose is to find cancer so early that it's easier to cure, and the treatment is easier for the patient, and there's less cost. And also you can prevent, I hope, some cancers by taking out adenomas, which are pre-cancerous lesions, which can turn to cancer later. So in that way you can also reduce the incidence of cancer. It has been shown that with this test, bowel cancer mortality can be decreased, but this Finnish study is a real population-based study. So in previous trials there have been some selection of the population where they do this trial. In our country we really screen normal population, so in that sense, it's more informative, and also obviously because you compare the control group and the real screen group. For an oncologist, oncologists they usually treat patients who have cancer. So for them, the message is only that this is something we have to study further. So it's, but the message to the GPs is that if there's a screening program going on, we advise to participate in that. There are many debates going on, especially on prostate cancer, but also on breast cancer screening these days. Perhaps it also reflects the financial problems many countries suffer from, because you have to divide resources to many different directions. At this point, I can only say that when we study enough, we know. So, but for those patients who have symptoms, even mild ones, which could point to colorectal cancer, of course, it's necessary to have the bowel examined by full colonoscopy in those cases.